What did you make of the Chancellor saying that the health service is rightly the biggest reason most of us are proud to be British?
I can think of quite a few reasons I'm proud to be British, but the NHS is not one of them.
Why not?
Why not? Well, it's not succeeding at the moment. It's not delivering what it should do for patients. He may say more money's going in, but it sure as hell isn't going into my pay packet. My pay's been frozen for 4 years. I'm not complaining bitterly about it, but I'm just observing that wherever the money's going, it isn't providing more units of care. Ask any patient who's on a waiting list, anybody who wants to get an appointment with a GP, you just can't. And that's because there's not enough workers at the coalface. And there is not enough time for those workers to do the things they're meant to do.
And this is the thing that is flabbergasting, because so much more money has gone in. Now, we know that the increases in the money that went into the healthcare service after 2010 and the years under George Osborne's chancellorship, they were still a real terms increase, but given the scale of the population getting older, getting fatter, the new treatments and the like, it wasn't on the same scale as it'd been previously. But we are looking at the sort of need for almost exponential growth, this bottomless money pit of the NHS, because we all get older and we're going to have an ageing population, and an awful lot of people are getting fatter. That costs more. And I do think you can't have a choice about getting old, but you can have a choice about getting fat. That is something we are going to increasingly going to have to address. But Christopher Snowdon, we spoke to earlier, from the Institute of Economic Affairs, he tweeted out yesterday new Office for National Statistics data, which I think will be astounding to most people, saying the supposedly understaffed NHS, he said, since 2013 in England, and these are full-time equivalent staff, not say someone working part-time once a week. We'll put the graphic up so people who are watching on TV can have a look at it. But overall employees of the NHS since 2013 in England have gone up by 35% in number. Doctors have gone up by 37% in number. We're always told you're not seeing more clinical staff. Nurses, midwives, health visitors up 23%. Support to clinical staff up 45%. NHS infrastructure and support staff up 41%. Now, I mean, that's an awful lot more people. I allow for the fact that the population's got bigger, Laurence, but only by about 7% in that time. I know that we've got older, but we've not got that much older. What is happening? Where have all these employees gone, and what are they doing with their time?
Right. Can we divide it into clinical coalface, doctors and nurses and people related to them, and other people?
Yeah.
An awful lot of people are needed to run the health service, and those people, that's where the big expanse has come.
And you need
More
admin
doctors
people. You need people who are going to call and say, here's your appointment. You
Sure.
can't run it with just doctors and nurses. We know that.
No, you can't. No. The number of doctors increased is nowhere near as much as the number of things you can do for patients. When there was no orthopedic surgery, because people were wheeled around in bath chairs until they died, you don't need orthopedic surgeons. You suddenly enable a wonderful new vista of things you can do to make people better, and you need a very large number of people to make that work. So orthopedic surgery, non-existent in Victorian times, now a huge deal for the NHS. Eye surgery, ENT, all sorts of things, many of which are not curing fatal diseases, but are most definitely making a difference to people's lives, particularly older people.
But hold on a minute. You're talking about Victorian times. And of course, there have been massive developments, and we're treating a lot more people who are older than, although we've discovered that other countries give more treatments to elderly people, which is quite interesting in latest evidence. But we're not talking about a vastly different era in 2013, for goodness sake. I mean, 2013 wasn't a vastly different world from where we are in 2024.
We've increased greatly the things we can do for patients without keeping them in hospital. We've made the service more efficient, and I immediately accept there's plenty more efficiency to go. But the fact that we can do so much more means the turnover of patients is faster, and the range of things that can be offered is more, and the need for more doctors and nurses rises. In 1948, when they started the service, they believed that they'd fix everybody would be cured, and the ongoing expenses would fall away. That was Nye Bevan's belief. The fact is, that's clearly not true.
Yeah.
And as you say, since 2013, more and more money is put in, and there are more people working, but the number of units of medical care and the waiting list has expanded hugely. And you're quite right. If we don't do something, this is threateningly an exponential rise in workload for the health service.
But how are other
And
countries coping? Because, again, one of the fascinating things is I can understand people in years gone by being very proud of the NHS, you know, first country to do this, make sure that people, doesn't matter, you know, you grew up on a council estate or a country estate, you're still going to get healthcare at the point of need. And that's a wonderful, brilliant thing. And that's something I'd never want us to lose. It's about mark of being a civilized country. One of the reasons I think America isn't a civilized country, actually, is because they don't have that certainty. But pretty much every other Western nation in the world, and by the way, pretty much most of Eastern Europe still provide that. I know people who go back to Romania to get operations because the healthcare is so good. We've got 7.5 million people on waiting lists. Some people have been on waiting lists, you know, a year, 2 years, are in great pain. People unable to work. And people, let's face it, dying because they wait too long for cancer surgery or heart surgery and the like. Why do other countries with similar GDPs, similar population levels, why do they cope and we don't? What are we doing wrong?
the biggest mistake we're making is to avoid the R word, rationing. And most countries have limits on the healthcare that you can get free from the state, or indeed under insurance schemes, how much the insurance scheme will stretch for you. And we don't see that here. Because it's so political, politicians are very scared of using a word that I've got no problem with, which is saying you can't have infinitely anything you ever want. And I'm not suggesting we should have co-payment either. I think that we just have to accept the NHS can't do everything. And the range of what we can do doesn't mean we should be doing it. We need to be much more mindful in a non-electoral sense of what the service can provide and what it can't do. And at the moment, we overpromise and underdeliver. And that is, I'm afraid, part of society in a wider sense.
Okay, but look, I can understand, you know, let's prioritise, you know, saving children from cancer over, I don't know, boob jobs for people who are unhappy with this. I mean, of course, most sane people would agree with that. However, what about, you know, what about some, you know, very expensive new drugs which are life-saving, but actually, well, you know what? If your parents haven't got the money, you're not going to be able to get it. But if your parents do have the money, or you can crowdfund it, you can get it. Again, makes me very uncomfortable. I don't want to be in a situation where, you know, I would be able to fund an operation or a treatment for my child if, God forbid, something awful happened, touch wood somewhere, but someone else wouldn't.
Around the rest of the world, that very unpleasant prospect is reality.
That's the norm.
I'm certainly, yes, it is. And I'm not advocating that for a moment. But clearly, you can't have an infinitely elastic NHS without the infinitely elastic workforce and budget to go with it. And we don't have that. And I'm not suggesting to the taxpayer that we should. Right. I just don't think that's reasonable. You have to start having very hard conversations, and not just in America, where there's a huge divide between the haves and the have-nots. In other countries too. Germany you have to have multiple insurances to make sure you're covered for the ambulance, because you're only covered for one ambulance by one insurance, not for other ambulances. And it goes on and on and on like that. And the countries that are most successful contain what they do largely within primary care. And we were doing that pretty well. But unfortunately, it's failed because we don't have enough GPs and nurses in the community to keep people away from hospital. And I'm not proud of that.
It's absolutely extraordinary. I can't see it getting resolved anytime soon, that's for sure. Really good to hear your thoughts. Dr. Laurence Buckman, thank you, as always, for joining us.